community. Northland Health Centers is growing and now has a new clinic for patients. Priscilla Dunham and Danica Burkett are here to tell us about their new services that they are providing. So good morning to you ladies.
Good morning.
Good morning. I think we have to open up the whole topic of, you've probably heard of it, right? Mental health. It's a huge thing and we're trying to bring awareness, and that's leading us into the month of May. So where do we want to start with that? How are we bringing in awareness to that, Priscilla?
Yeah, so May is Mental Health Awareness Month, like you just mentioned, and the theme for 2025 is bringing awareness into action. So, you know, there's still very much a stigma around mental health. However, there is awareness that it's, you know, here and exists and is present. And so this year we're asking folks to bring that awareness into action.
Danica, I'm going to move to you. Is this somewhere where it's like we have to do it ourselves, or is there community action that also helps?
Yes, there's definitely community action. And I know at Northland we strive really hard to make sure that we can provide those services to our community, whether that's, you know, opening new services or expanding the services that we already have.
I think that's super important too, because I think mental health is just as about as powerful as your physical health. Is that the case?
Yeah, that's true. They're synchronous. They go hand in hand. So you can't have physical health without mental health.
I think that's super important too. So tell us a little bit more about these new behavioral services that you guys are offering.
Yeah, absolutely. As the need for mental health services continues to grow, Northland has worked really hard at expanding our services. So we've added some new providers. We've also, like you mentioned, opened our new clinic in Bismarck North, a very beautiful clinic. So everyone's welcome to come check it out. We're also looking at going into the school certified services as well as addiction services, hoping to get some sort of groups going as well.
I think that's important. Priscilla, I'm going to go to here because because medication management is one of the things that you do at the South location in Bismarck. Yep.
That's right.
So elaborate a little bit.
Psychiatric mental health nurse practitioner. I see patients age 5 and older, and so I provide medication services to them. So any folks that you know, their own personal mental health journey, they're needing more support around it, they can come to me for medication.
And then Danica, what do you provide in?
Yeah, so I'm a mental health therapist up at the North Clinic, and so I provide services for people ages 5+, so children, adolescents, adults, and we do offer telehealth options as well.
Let's expand on that telehealth, because that's something you probably didn't hear much of in the past 5 years, and then holy cow, it's 2025, it's all over the place. How has that benefited patients as well as Northland Health Services?
Yeah, so at Northland, that's one of our missions, is to kind of reach folks, the underserved folks and the folks that maybe aren't in the bigger city community areas. And so we really want to make sure that we can provide those services to everybody. And so we have the telehealth option where folks can connect from the convenience of their own home to accommodate to their busy schedules.
I think that's super important too. And I'm reading some of your notes here, and I think too, when we talk about the mental health aspect, I think of it kind of like almost depression sometimes, like you kind of just need something to get through the day, but there's also like drug use and things that you guys help with. Am I reading that correctly? There's also more to that. At least that's what I kind of think of it.
Yes, absolutely. We've been working really, really hard at opening addiction services as well. Okay. Yeah, and so hopefully we can help target that population too.
So two different things.
Yes.
Okay, I'm glad we cleared that up here too. And then also, where does like insurance come into play in all of this?
Great. So we at Northland Health Care Centers, we have a sliding scale fee and we accept all insurances. And so for folks traditionally in the past have sometimes had to pay out of pocket or you know, seek private services for that. But we want to make sure that healthcare, or that the mental health is accessible to all folks.
Accessible to all, that makes sense. What is the sliding scale? I've actually never heard of that before.
So kind of depending on what your income is, we take that into account and then offer lower rates for folks that that financial barriers exist.
Okay, that makes sense. That makes sense. Now, when it comes down to the call to action for us during Mental Health Awareness Month, what are we doing? How do we take part?
So really reaching out to your loved ones, to your family, friends, anybody that is struggling in the community that you may know. It's never too late to ask for help. We're here to support folks, and that's another thing that individuals can do is support one another.
And it's ever so important, more and more as we go on, right? Yes. Mental health, it's super important. Where can we find more information about Northland Health Centers? We do have some information up on the screen, but where else can we find Northland Health Centers?
Yeah, we on our website is a fantastic place. We also have a phone, and then we do have a Facebook page. We have an awesome marketing team that works really hard at all of that.
We appreciate it. And for those wondering where Jenny Cornell is, she is standing in the back. You guys did wonderful. Thank you, ladies.
Thank you so much.